What's up, guys? Hope you're having a killer week as I am. Beautiful weather here in Connecticut. Hopefully, everyone's enjoying summer. I know we're at the end of August here. We're going to talk about figuring out a pinched nerve in the neck, right? If you haven't seen the video from last week, go back and watch it. We talked about the number one cause of neck pain. Anyone remember? If you do, comment down below because I'm not going to give it away. I want you guys to watch that. It's really important that you go back and you start there if you haven't seen it, or check out the comments to see if someone posted it below. All right, so in a few seconds, we'll get into the topic for tonight, which is going to be patient history, right? Physical examination, which we refer to as pain and performance assessments here at Choffner Physical Therapy. And then number three is imaging studies. So that is how you figure out a pinched nerve in the neck. And we're starting with number one, patient history. There are 5 typical questions I like to go through with all patients. But before we dive into those, I want to make sure to rule out all red flags. Right? Red flags are potentially bad things that could be happening that are a lot more serious than just neck pain, right? Some of those we can go through or giving you some examples or unexplained weight loss, right? History of cancer, a recent car accident, like a whiplash injury where your head slaps forward and comes back and your brain can kind of juggle around a little bit in your skull and knock against it. And that can cause some issue or even like hematomas or swelling. Bladder dysfunction's another big one, right? Night pain that's unrelenting, that gets worse as you go throughout the night. That's another big one. Those are some of the most common. There are a lot more, guys, but just pay attention to those. And you want to make sure if you have those, you go and see your doctor right away. And I don't mean your physical therapist. I mean your orthopedic doctor or your primary care doctor. Okay. So make sure you understand that. Very, very important. The 5 questions we're going to go through is number one is when did the pain start? Right? Did it start last week? Did it start like after a car accident? Did it start years ago? Like you really have to go through your history with the physical therapist to figure that out because it's very important. Was there a traumatic incident that took place? Or did you just wake up with that pain one day? Because it's important to understand you can have a pinched nerve from degeneration over years, right? From working and from bad posture, or just from time. Okay. Time can actually do it on its own, or you can have it from trauma, right? Like a car accident or someone like knocking your head or you getting hit playing football by like a teammate or something. Right. The third question is, does anyone in your family have neck pain? And if they do, for how long? You want to know your family history because that plays a role in it as well. The fourth question is, are you on any medications, right? There could be side effects of medications that could be causing this neck pain or this weird burning and numbness and tingling in your arms that can be coming from your neck, could be coming from a pinched nerve. And then number 5 is, what have you tried so far? You really want to find out, did they try medications? Did they try chiropractor? Did they try PT? Did they, maybe try some things on their own through YouTube or Google, right? What tends to make them feel better and what tends to make them feel worse? Those are very important because, guys, when people tell me what tends to make them feel better, that's something I'm going to start my programming with, right? I know that they've had good success with that thing in the past. So why would I not use that again? Even if it's something like using electrical stimulation through the little pads, they call it STEM in short. Maybe it's ice or maybe it's heat, maybe it's biofreeze, maybe it's Voltaren gel. I don't care what it is. If it makes them feel better, I'm going to use it as long as it doesn't cause side effects or put them at harm. Okay, so that is number one, patient history, and those are the 5 questions. So again, remember to rule out those red flags. Now, number 2 is physical examination, right? Where is the pain is the first thing we want to start with. We want to know, is the pain in their neck? Is the pain at their kind of wrist? Is it at their elbow? Maybe at their shoulder? Because sometimes if you have pain down here and nothing at the neck, it could still be coming from the neck, right? A lot of times pain originates from the neck because that's where the nerves start and that's where they kind of come off of the spine. So you want to make sure you know where the pain is. What do the symptoms feel like? It's another good question. Is there numbness and tingling? Is there burning? That's nerve pain. Okay. So that usually means there's some kind of impingement in the nerve, either at the neck or maybe under the armpit because you have a brachial plexus here, which is just like a bunch of nerves mixed together. Is it sharp pain? Right? Is it aching? You have to rule out muscle from nerve pain through kind of taking this history and going through this physical examination process, which we do online with patients too. All right. The third thing here is range of motion screening. We want to go through range of motion looking at the neck, which has 4 different motions, right? Flexion, extension, side bending, and then also turning side to side. You want to make sure you go through all of those motions and you want to look at the mid back. You want to look at your thoracic spine through extension and rotation. You want to look at your shoulder blades too, because they're in very close proximity to the neck. Make sure they're functioning properly. And after you go through all that range of motion, right, then you want to go through strength testing with reflex testing as well. You want to test your reflexes to make sure the nerves are working, right? So you don't have delayed reactions or anything, or they're not working. So you want to make sure you have full strength because if you do have a pinched nerve, that nerve is getting pinched to a certain degree that'll make the muscles weak because the nerves are what gives the muscles energy to kind of grow, to change and actually get stronger and actually fully function. So if you have a pinched nerve, you can feel numbness and tingling, but if it's pinched a lot, then you're going to get weakness with it and your muscles are going to shrink over time. And that's another big red flag where you have to see the doctor, because the quicker you get it diagnosed, the quicker and easier it is to fix it, and the less likely you are going to be to have surgery. Okay, so that's strength screening. And again, you want to look at strength at the neck and the areas of the mid back and shoulder blades. Okay, you even want to look at the kind of muscles around the elbow and the wrist, right? Because the nerves actually start at the neck and they go all the way down the arm into the hands and the fingers. So you want to test the strength. Even grip strength is important to test, to know kind of what nerves are affected, what level of the spine is affected through doing that testing. Right. And then the last thing here is special testing. Special tests is just a kind of fancy term, I guess, not even fancy, but it just means that you want to go through these tests to rule in or rule out certain things. So the two tests I like to use the most is number one, Sperling's test, and number two is traction or distraction test. Okay. Sperling's test, you guys can look up. It's literally just closing the space in the spine on one side. So if I want to do Sperling's test and test the right side of the neck, I would have the patient bring their head back, bring their right ear to the right shoulder, and turn their head to the right. Okay, if they had no pain with that, I would put straight pressure through their head going down toward their opposite armpit through this way. And if they had pain with that, that's a positive test. That means that that nerve is getting pinched there. And I can do the same thing on the left side going through the opposite motions. Okay, so that's a very important test to do to rule it in or rule it out. The other test is traction or distraction. So usually I'll have a patient sit in a chair for this one. I'll kind of sit behind them. I'll come under their ears and I'll try and lift their head upwards. So I'm trying to kind of lengthen the neck a little bit. So I'm pushing the head up on the trunk. And if they feel some relief with that and the pain actually goes away in their neck or anywhere in their arms where they have symptoms, that's a positive test, meaning that they're most likely dealing with a pinched nerve and they should be doing more of that distraction or traction. I've also done it with people laying on their back who are really sensitive and a lot of pain, and I pulled with my hands on their head. You can do it yourself using a band at home. If you wrap a band around something, and then you kind of put it under your ears and have it pull you backwards, it's the same thing. Just have to be a pretty thick band. So that's physical examination. Number three, and the final topic for tonight is imaging studies. Fancy term for x-rays, MRIs, right? CT scans, etc. So listen closely here. If you went to an orthopedic doctor, you had an x-ray with no findings, right? There was nothing abnormal that they saw. You took prescribed meds from the doctor, right? You went through 48 weeks of physical therapy, right? And nothing really happened. Your next step should be to get an MRI, right? Especially if the symptoms have worsened or they've stayed the same and you've been doing PT consistently while you scale back your activity or you modify those activities for at least 6 weeks. If you've gone through 6 weeks of taking the medications, you had the x-ray, and you've been doing PT, listening to your PT, coming at least twice a week, doing your stuff at home that you need to, scaling back, right? And you still have it, that's a good time to get an MRI, unless you want to try seeing like a chiropractor, an acupuncturist, or any type of healthcare practitioner, right? Insurance will cover that MRI if they've seen PT is not working and your symptoms have progressed or they really haven't changed and they've flatlined, right? And this is really based on the physical therapist's notes. Excuse me, I can't talk. They want to make sure the physical therapist is actually kind of writing down good notes. And if they are documenting everything, and that's why they ask you how you're feeling every time you come into the clinic, then they're going to most likely approve you for the MRI. So then you don't have to fight with them and you're not going to hit with a big bill. Make sure you call your insurance company, talk to them first before you go and sit for the MRI. Okay. So that is the topics for tonight, guys. So hopefully now we know the number one cause of neck pain. If you haven't seen it, again, go back and watch it. We'll go through that. It was a quick 5-minute video. Now you know how to figure out if you have a pinched nerve through patient history, physical examination, and imaging studies. And if you've had neck pain for over 3 months, go see your doctor right now, guys. Get a script for physical therapy. See what's going on, get it figured out. Right? If you have good insurance, it won't cost a ton. Then you can come see us for physical therapy. But it's kind of like post-physical therapy. We help people who finish physical therapy, but are still not able to do what they want, right? Like return to normal weightlifting routine. All right. So thanks so much for watching, guys. Be sure to like and subscribe if you're watching on YouTube. If you want, we made a pain science guide last month. Comment pain down below and we'll give you that pain science guide that teaches you how to better understand your pain and conquer it. And this is for any type of pain, meaning anywhere from the head all the way down to the toes. So thank you guys for tuning in so much, and we will see you in the next one where we talk about neck pain treatment. Take care.